Hello, my name is Leah Dionisi. I'm now a third-year student at KUMC. I'm very excited to be presenting this today. Thank you for the opportunity. So the title of the presentation is Assessing Interventions to Increase Student Volunteer Competence Surrounding Social Determinants of Health and Community Resources in a Student-Run Free Clinic. That's kind of long, but we'll break it down in the slides to come. So just a little background on what JDoc Free Clinic is. It's designed as an acute care, kind of urgent care clinic with the intent to serve uninsured or underinsured patients in the Kansas City area. It's usually a general medicine night, but we also have several specialty medicine nights. It hosts a variety of different medical professionals, from volunteer physicians and med students to pharmacists, pharmacy students. Dietetics is involved, clinical lab science, even there's a dental night component. And additionally, there are other volunteer groups like undergrad students who man the front desk and handle all of that paperwork. And then lastly, there is a group of about 20 undergrad or gap year students who make up what our social services department is in clinic. And those students are led by two second-year medical students who sit on the executive board of the clinic. And JDoc serves quite a few patients. I think in 2019, we served over 1,000 patients. So we try to help in a variety of ways, not just medically, but also through our social services department. So I was able to be one of those med students in charge of the social services department last year. So that's kind of where this came from. So JDoc is a great educational opportunity for medical students to start practicing their clinical skills. I think they can start their second month of the first year of med school. They can start volunteering. But a lot of us on the board also felt like with this unique patient population, it's kind of a rare opportunity to see firsthand what the influence of social determinants of health can really be in patients' lives. So, given that, we wanted to see, how effectively our students are gaining so many clinical skills, but how effectively are they able to discuss these social determinants of health with patients? Are they able to suggest their own resources to patients, kind of get an assessment of how well our medical students are doing on that end of it. So as far as methods, this was kind of a twofold purpose. One, to assess how well our students are doing with those things, but also to take the opportunity to implement a few interventions to see if we can maybe increase some of that student knowledge of resources and maybe increase their competence in that area. So 3 interventions were implemented last year. There are biannual volunteer trainings, and so we presented social service offerings at those trainings. We featured a different area resource in clinic each week to hopefully increase knowledge. And then lastly, reflection can be a very powerful learning tool. So we implemented what I'll call a reflective piece, where, at the end of each clinic appointment, the medical student brings their patient to check out with social services. And those interns, they bring up any needs that were brought up during the appointment, and they address those, but they're comprehensively screening for any social need that those patients might have. And so that's a really good kind of baseline understanding of what our patients need. And then they go ahead and document that encounter in RedCap, and then that's what I kind of read over every single week on every patient. So using those documented encounters by our social services department, and then our student physicians, every time they brought their patient back, they filled out one of those reflective pieces. And it kind of entailed just filling out, what social determinants of health did you discuss with your patient? Were you able to suggest any specific resources for your patient during the appointment? So we took that reflective piece from the med student and compared it with the social services documentation, and kind of, determined how well are our students doing in suggesting and discussing these items. So the reflective piece was an intervention, but it was also a data collection tool as well. And then lastly, sorry, excuse me. to we wanted to assess, we wanted to ask med students how helpful were these interventions for you. So we just administered a survey to the students asking how helpful were they in your knowledge and your proficiency in suggesting resources. But we also asked what their perceived ability, of their own ability to discuss these things, so that we could kind of compare their perceived ability of how well they address these things versus kind of an objective measure of how well they were doing. So now moving into some results, there's just a few slides on this. So first we wanted to look at what are students' perceptions of their own competence surrounding discussing these social determinants of health and suggesting resources. So as you can see in the table, about 44% rate themselves as good in their proficiency to screen for social determinants of health. 41% rate their knowledge of resources of what's available as only fair, about a 2 out of 5. And then when it comes to proficiency in recommending these resources that they do know, about 41% rate themselves as average in being able to recommend resources. So that's kind of their own perceptions of their ability. So now, okay, how well are the medical students actually screening for these things and recommending? So we measured it from about 125 different student reflection pieces. And as far as, what percentage of what social services is discussing with patients, and what percentage of that are students addressing. And if you look at the graph, figure 1, the average of that is about 51%. So our med students are discussing in the clinical appointments about 51% of demonstrated patient social determinants of health. And it's broken down by class, M1 versus M2 classes, just with a trend over the course of 2 months. And then if we look at the graph on the right, figure 2, that one is measuring, the percentage of what resources were offered to the patient, what percentage of that were medical students able to suggest, and it was about 36%, which I thought was quite good, considering they don't have much background knowledge on specific Kansas City resources. So that was encouraging, and of course broken down again by M1 and M2 class. So there's not necessarily a difference between, visually at least, between M1 and M2 classes when it comes to these items. So, that 36% that students are able to recommend, I was curious what kind of resources are they more familiar with? And this is just a pie chart of several of the items. And a few of these we were featuring in clinic each week. So that's nice to know that some of those stuck over time. And then lastly, we asked through that survey, how helpful were these interventions for you in not only increasing your knowledge of available resources, but also kind of, in improving your proficiency in suggesting. So just looking at the 3 different interventions, in terms of increasing their knowledge of resources, about 68% of students found those presentations at the volunteer trainings to be absolutely or somewhat helpful. And then about 67% found the featuring of resources in clinic each week to be absolutely or somewhat helpful. And then in terms of improving, their proficiency in suggesting resources, for the presentations in trainings, about 48% found that absolutely or somewhat helpful. With the featuring resources in clinic each week, about 59% found that absolutely or somewhat helpful. And then in terms of the reflection piece, increasing that proficiency, about 53% found that helpful. So when it comes to the reflection piece, I didn't ask if that helped their knowledge. I added another question to ask if they felt that the reflection piece increased their own awareness of how well they're screening and discussing these items, and about, as you can see, about 64% of students said that they did feel it was helpful in increasing their awareness. So in conclusion, the purpose of this study was twofold. It was to assess how well are our students doing with these skills, but also to implement these interventions in an effort to improve those skills. So, results suggest that generally these three interventions were helpful in improving, their awareness of how well they're doing, and improving their knowledge and proficiency. Most were in the 50 to 60% range in terms of helpfulness. And then, assessing how well our students were doing, the students were able to address about half of demonstrated patient social determinants of health, while a third of the time they were able to suggest even specific resources. So, in addition to the medical skills and the clinical practice students are getting by volunteering at JDOC, it's our hope that they're also picking up increasingly important skills as they're growing into a physician, in terms of, at the very least, being able to recognize these issues for patients and seeing firsthand how they impact patient lives and how they impact patient health. And any field you go into, that's going to play a role in the future. So our hope is that they start to become aware of that, and we thought maybe other clinics might find this helpful. And there are a ton of student-run free clinics around the country, but really any educational structure or program might find this initial kind of assessment helpful, and maybe identifying ways to train student volunteers to best serve their population in the future. So, future directions, probably, we could implement more of a structured training program, and how to, we get some lectures in our curriculum at KU, but maybe more of a structured program to learn how to screen and maybe how to bring up these kinds of social determinants of health with patients in an appointment. And then, of course, the interventions that we implemented could definitely be expanded. One piece of feedback was, maybe having a reference sheet that students can use in clinic of the main available resources that they could be suggesting to patients. So just little expansions like that. So that's all I have, but would like to thank the executive board that I was able to be a part of for the last year at JDOC. Our advisors were incredibly supportive, the Board of Trustees and KU Endowment, and our social service interns who helped facilitate a lot of the paperwork of this project. And then lastly, the patients who are so willing to come to us to entrust us with their care. So thank you to all of them.
Thank you, Leah. That was super interesting, and I'm excited to ask you a couple of questions about them. So one of the questions I had is, what happened after November when you ended your study? Did you continue to gather data, or did you continue to bring services into JDOC to be featured, or what continued afterwards?
Yeah, great question. So the introducing the resources in clinic each week, that actually started probably around July or August. But then I didn't start measuring with the reflective pieces until about October, November. And it continued a little bit into December and January, but the numbers just weren't consistent. And I think all of them were given out on maybe just a few nights. So it was probably the same student physician seeing multiple patients. So I didn't feel like that data was as valuable. So I stuck to the October, November. But I mean, if I could go back, I would want to try to continue this over the course of a whole year to see if there's any kind of growth. I think that would have been awesome, but I didn't get to it probably soon enough, really.
Sure. Oh, there's a limited time for everything in life. I was curious, it looked like from your objective data you gathered from the graphs that you presented, that there wasn't a consistent, I mean, you were able to determine an average for like what people were aware of and what they were able to address, but it didn't look like I saw any trends over the 4 data periods that you collected.
Right.
Were you able to draw anything from that as far as M1 versus M2 or late November versus early October?
Sure. Yeah. It kind of makes me think that, there's no difference necessarily and I think even the M1, the M1 trend was at a higher percentage, actually, I think, than M2. So, that just kind of makes me think that it's probably very individually driven, personality driven, I would say, of maybe specific students who are more in tune with that or more aware of that need at clinic. It was only over the course of 2 months, so it's hard to know really if there was real growth there, because students really, on average, probably the consistent volunteers probably are volunteering once a month. So they're only hearing one resource a month. So it's hard to tell if the hearing resources in clinic really had an effect on any of that. So which is why it would have been so nice to see long term. But I have other data that, I asked them on those reflective pieces about how often have you volunteered in the last month or two, to try to stratify by volunteer rate. But I didn't include that on the little poster, but if I take this further, I might include information like that. But I actually didn't see any major trends with that component.
Got it. What was the time burden for data gathering for you and for others who participated in the study?
Sure. So the social service interns, they were the ones handing out these their role was to hand out the reflective piece to the students. And then, of course, they documented their encounter with the patient just like they normally would. So really, I think early in December, I sat down with all these things, and it took a decent amount of time because, I had to match patient ID. Sorry, excuse me. It took a decent, sorry.
That's okay.
Okay, I'm better now. It took a decent amount of time to sift through each patient, and determine in the medical note, determine what they were offered and what they needed, and then compare it to the student reflective piece. It took a decent amount of time, but I was running through those social services documentations every week anyway, so I was pretty familiar with the layout already, but just a necessary evil of the project, of course.
Yeah. And my last question is, so do you anticipate doing any of the items you identified as your future possible actions? I was most interested in the handout because I think that could be really helpful, not only as a student-facing piece, but as a patient-facing education piece.
Yeah, absolutely. Yeah, good point. So first I'll answer, unfortunately we're limited to a year-long term with this board, but there's a period of transition where we talk about to our successor, all of these things we learned. This is one thing, we really wanted to work on but didn't have time for. So all of those ideas were passed on to my successor. And she was actually a previous social service intern, so she already had a lot of familiarity with the process. But ultimately, it's up to her, of course, to structure it how she wants. But that information sheet would have been my next step. And there was one sheet posted in clinic, just on the wall. But yeah, having a little reference sheet for students would have been good. I was able to present this at the conference for all the student-run free clinics in the country back in March, right before Corona hit. One clinic actually had taken this a step further and made that handout piece for students. And they not only had it at their free clinic, but they also gave it to their third-year medical students who were starting on the wards, and a few of them were able to use it even outside the free clinic setting. So, that idea was passed on, and that would be the goal, to, not just at the free clinic, but incorporating it into future rotations as well. But I wasn't able to. But.
Yeah. Well, thank you so much. I really enjoyed listening to your poster presentation, and I thought your research was very interesting.
Thank you. Thank you for helping facilitate. I appreciate it. It was nice to meet you.
All right, thank you both for joining us today. And this is one of our medical student poster presentations that we're doing virtually this year in lieu of our in-person meeting that we would have had in June. So thank you both.